Good evening. I am President Greg Crawford of Miami University, and thank you for joining us this evening for this press conference. I know you are anxious to hear the results of the CDC's test on our possible novel coronavirus cases here at Miami. I would like to introduce Dr. Amy Acton, the Director of the Ohio Department of Health. Dr. Acton will share with us the results and will provide clinical guidance on next steps based on those results. Dr. Acton?
Thank you. Good evening, everyone, and thank you, President Crawford. I am absolutely here to announce that the tests for the 2 Miami students have just been returned from the CDC. Again, we apologize at the late time. I know this wasn't the best timing, but we promised you we would share the results. I'm very pleased to share that the results are negative for both students, and they are thrilled. You'll hear more about that in a minute. Now, while these are very good results, we understand very much that there's still a lot of concerns out in the community and around our country tonight. Let me say again that we have no confirmed cases in Ohio, and now we have no PUIs, patients under investigation. What we are doing in Ohio is working. As I said before, we stand ready. I sit atop a group of just the most outstanding scientists, local health department, epidemiologists, and emergency preparedness staff, our universities, and our hospital systems. And we have been working 24/7 since the first stories broke in China. And this case, as I've said before, is evolving. We will be keeping you up to date as the situation changes. It's almost on an hour-to-hour basis. Because this is a novel disease, we learn more hour by hour. And so we at ODH will be keeping you abreast of that, odh.ohio.gov, constantly over the weeks to come. As I said, the students are delighted. I want to emphasize that there is a huge need for compassion and care for our students and literally all around our state, because as I said before, we have many students, many citizens in Ohio who have traveled, and many business people who travel. These students were the victim of circumstances, and they have been amazingly cooperative and graceful. As I said before, it's very hard as a parent when your student is away. Maybe they break a leg while they're traveling abroad. Maybe they get sick and you get the phone call. We all know what that is like and how scared we are and how much we really count on the universe we're now in to take care of us. And Miami and the community has done an outstanding job. I really want to thank the team at Miami University, the Butler General Health District, just outstanding work by this local health department in partnership with the Middletown and Hamilton City Health Departments. They've worked tirelessly. I can tell you, we don't get a lot of sleep on these teams. We've worked hand in hand, again, very closely with the CDC, with the World Health Organization, with our states all around, and with the CDC most importantly. We have found a newfound support system at Miami, and my hope is to learn more about what students will be doing here in the time to come for each other. And as this humanitarian crisis spreads around the world, what we can all do in Ohio to help those around the world. With that, I'd like to introduce Butler County General Health District Commissioner Jennifer Baylor to share more details.
Thank you, Dr. Acton. Well, this is good news indeed. Thank you for coming to help us spread the word about the results for which we have been hoping and praying. My name is Jenny Baylor, and I'm the Health Commissioner of the Butler County General Health District. I am also a Miami graduate, a Miami merger, and the parent of 3 recent Miami grads. So working this investigation meant a lot to me personally. I want to begin by commending the 2 students involved in this situation for their very, very prompt action taken in reporting their symptoms to the Student Health Services just as soon as possible. I want to emphasize that these students did everything right to allow a rapid response to contain whatever virus was making them ill. They fully understood what was going on with coronavirus, and they knew that they needed to report right away. They were responsible, conscientious, mature, and cooperative with every step of the investigation. I encourage others to be just as responsible. This quick reporting allowed a rapid investigation to begin. A system was put in place a few weeks ago as coronavirus ramped up in China, and we knew that travelers would be returning here. The system worked. The pre-planning between Miami Student Health Services and the Butler County Public Health Department paid off. Students were isolated, alternative housing was found, meals were provided, and calls were made to check on compliance and symptoms immediately. The students fully cooperated with all requests made of them. We were all on this. I'd like to recognize my staff for a job well done, for their diligence in preventing disease, and for promoting and protecting the health of the public. They are amazing. Every day, public health works behind the scenes to ensure that you don't get sick by, for example, eating poorly prepared food, or by a contaminated body art needle, or from a broken septic system, or, in this case, from a novel emerging virus. I don't mind saying that we do all this on a shoestring budget. An adequate funding stream for public health is critical in order for this vital work to continue for you, the public. We could not do our work without our partners, Miami University, Tri-Health, Butler County Emergency Management Agency, Middletown and Hamilton City Health Departments, police, fire, and EMS from Miami, Oxford, and Oxford Township, and of course the Ohio Department of Health. These agencies and others have been terrific partners. We can now say that Oxford has no cases of coronavirus, no persons under investigation. Yes. So go out, do your thing, watch some football, wash your hands, and be kind to one another. Enjoy the rest of your day. Love and honor. We will now take some questions.
Do you guys know what made the students ill and how they're doing right now?
They're doing very well. What made them ill, we're not really sure. Some other virus.
Either to you, Jenny, or to you, Dr. Agnew. On Friday, Dr. Fauci said the test for the coronavirus is not a precision instrument, and he said there have been cases where there was a negative diagnosis and then there was further illness and they tested again and the virus was there. How confident are you that this is the real thing?
I'm very confident that in this test with these students, given their history and where they are in the disease process, this is an evolving science. So make no doubt, and please pay attention, because I think we'll be learning more and more. And this is to be expected. This is the course it takes. We're lucky to have scientists like Dr. Fauci, who is, renowned. They are all working, again, 24/7 to understand this and to get the best answers to the public. These students were symptomatic, and usually during the symptomatic period, the testing is good. But we're paying attention to that as well.
Did they have a fever?
I really don't feel comfortable giving the details of their situation,
Okay.
but I can just tell you that they're doing very well today.
So they are no longer under isolation.
Correct.
When did you release them?
Just a few hours ago.
When did you get the results from the CDC?
Well, I got them a few hours ago. Dr. Acton got them a little bit before that.
Seconds before. I had to drive 2 hours, so that's the only delay. And to give you time to get here.
When and how did you all notify parents and students here? I assume it happened before this press conference.
Our communications are going out now, correct, right now as we speak, yeah, thank you.
What happens next? What are the next steps? Obviously, I guess this put people on alert for a little while to wash their hands. Masks were being sold, at local pharmacies and stuff like that. What are the next steps?
So there are still some people who haven't finished out their 14 days since they've arrived back in the country, so they are still self-monitoring. Our public health system, the wider system, stands ready to accept anyone and everyone who has questions about their health who may have traveled to China. So hospital, urgent cares, student health service, they are all ready to accept anyone, and we'll redo this whole process again if need be.
This is for President Crawford. I'm curious how Miami has prepared, for a potential increase in more racist and xenophobic behavior that we've already seen both on campus and online from students and parents. Just in general, what is Miami prepared to do?
Thank you for your question. In our communications that we sent out, we did ask the community to really be compassionate and to have empathy for those students that were experiencing the isolation, and to have those that in the community that were not, and so to be kind to them. And so we kept that regularly in our communications going out to campus. But I must say, in a time like this, when you're faced with challenges, the best comes out in people. And the leadership was extraordinary here across the campus. The leadership at the Butler County Health District was incredible. The Ohio Department of Health and their leadership was great. And all around campus, I really saw love and honor shine through in this challenging time.
I can add to that, the faith community in Oxford has written a joint letter, and it will be hopefully published in the paper, addressing some of the difficulties of being a Chinese student right now in communities that are fearful. We are encouraging all over the city, reaching out to students and making them feel welcome. Oxford is a pretty amazing place, and they are doing everything, we are doing everything that we can to make students feel welcome here in the midst of this crisis.
Do you feel now that whatever cases were going to be here in Oxford and Miami, that the 14-day incubation is passed, and that you may not see any more cases here? Are we out of the
You're
woods?
asking me to speculate.
Well, I'm
and,
not just asking you if you think we're out of the woods.
You're asking me to speculate. I'm not prepared to do that.
Any other questions?
There's a large Chinese student population at the Middletown campus and at Hamilton campus. Have they been checked for those that went home during that break?
The short answer is yes.
Okay.
Any other questions?
Do you guys have it, I know you can't release under the law like their names or anything, but a lot of states have been releasing like the genders and the names. Can you release that?
Yeah, this is a small community, and I can't release anything that would lead to finding out their identity, even if it feels simple and innocuous to you. I would prefer not to do that.
Will they go to class tomorrow?
They have been cleared to conduct all of their normal activities.
I wasn't clear on Tuesday. Were these students in Wuhan or in Hubei province before they came back to the United States, or were they elsewhere in China?
One of the students traveled to many different places in China.
Including Wuhan and or Hubei province?
Probably.
Is it confirmed that both the students are international students? I know that we said that the first one who showed the most symptoms was an international student.
Yeah, so again, I'm just not going to give you any more details about the students, please.
You guys had said that you were pretty sure they were isolated and so that you didn't have to worry about the community here at the university or the town. But they were on planes and things like that. Were you guys doing that contact check with everybody that they could have interacted with?
Hi, everyone. There's a system in place for all cases. We have not had a case, and then a contact investigation protocol that exists that goes on beyond our state. So I just want to conclude, with this. Please stay tuned. Do come to our website. We will keep you up to date as we learn more. As you know, the news is changing rapidly on the situation. I can't say enough. We have so many people in Ohio. I'm hearing stories every day from people I know, businesses that are struggling, people who traveled, people who weren't international students who traveled, people that are are watching, that have traveled in the past 14 days, that are self-monitoring, and there are clear guidelines by which to do that, all on our website. Just be thoughtful, be flexible. Businesses are trying to be flexible. The kinds of things we've seen here at Miami are happening all over, and so that call to sort of being thoughtful and helping each other when people are scared, as I said, it's much more contagion of fear. We still remain very low risk in this country. So I think that will be it for now, but thank you very much.
President Crawford, one more question for you. Does Miami know how many students went home to China over the January break? And how many went to Wuhan?
We do. Jane, do you want to talk it to some extent, if you want to?
No, I don't have an exact number of how many were in China.
President Crawford, 5 sports teams traveled elsewhere this weekend after 2 opponents, or like 2 of Miami's opponents canceled. Is there any talk of like canceling further trips or rescheduling that?
The teams that canceled early in the week, those games will be rescheduled, and I believe one will be this week, tomorrow, and then the other games we are planning to reschedule those other games. Thank you, everyone. Have a good evening.